future doctors. Welcome to Scripts and Studies. I'm Nigi, your study partner and the face behind Scripts and Studies. I know the med school can feel like a mess of confusing terms and its notes. But don't worry, we're making it one, visual and super easy to remember. This is just the beginning of an exciting new chapter, so grab your stethoscope and let's dive into this journey together.
So guys, let's come together to turn your dreams into reality. We are excited to start our section today. Our topic for this session is general anatomy, the foundation of all medical knowledge. Let's dive into understanding how the human body is structured, one system at a time.
Guys, do you know the term anatomy? Anatomy, which has two terms, ana and tomy. Here, the ana is the Greek word which means up or to see and tomy which means cutting. So the overall term of anatomy which means like cutting up or observe the body parts. Now we are going to discuss about the definition of the anatomy. What is anatomy? Anatomy is the study of the structure of human body and its parts like bones, muscles, organs and tissues. It tells what is inside the body and where it is located. So guys, the next topic is types of anatomy. There are mainly two types of anatomy, gross anatomy and microscopic anatomy. First, we are going to discuss about gross anatomy. Gross anatomy, which is also called microscopic anatomy. This is the study of parts that you can see with your naked eye, like heart, liver, bones or muscles. It's what we see during the dissections in the labs. The next one is microscopic anatomy, which is called as histology. This deals with the tiny, very small, minute like tissues and cells, and you need a microscope to study this. Now, I will give you simple examples to understanding this topic more. Let's go. When we study with skin, we look at with our eyes, that is gross anatomy. But when we see skin scales under the microscope, that is microscopic anatomy. I hope you understand very well. So guys, next we are studying the three main ways to study human anatomy. That is the regional anatomy, systemic anatomy, and the clinical or applied anatomy. Let's focus on regional anatomy. In this approach, we study one region of the body at a time. That include all the bones, muscles, blood vessels, and nerves in that area. For example, when we study the chest region, we don't just look at one system. We learn about the ribs, intercostal muscles, lungs, and heart, the nerves supplying them, and the blood vessels too, that all together. Now, what are the major regions of our body? They include head, neck, thorax, abdomen, pelvis, upper limb and lower limb. The head region is further divided into face and the skull. In the thoracic region, can you guess which major organs are found? Yes guys, that's the heart and lungs. These are two of the most vital organs in the human body. Separating the chest and the abdomen is a dome-shaped muscle called diaphragm. Below the diaphragm is the abdominal region and further below lies the pelvic region. We also have the upper limbs which include the shoulder, arms, foramen and hand, and the lower limb which include thigh, leg and foot. Now let's move on to two important regions of human body, the upper limb and the lower limb. The upper limb region. The upper limb consisting of three major joints, that's the shoulder joint, elbow joint, wrist joint. We can divide the upper limb into the following regions. The area between the shoulder joint and the elbow joint is called the upper arm, also known as brachium. And the area between the elbow joint and the wrist joint is called the foramen, also refers to as the antebrachium. The region below the wrist joint is called the hand. Each of these regions contains bones, muscles, nerves and vessels that work together to allow movement and functions. And let's discuss the lower limb, which is also divided based on the major joints. The lower limb includes three major joints: hip joint, knee joint, ankle joint, And we can divide the lower limb into the following regions. The area between the hip joint and the knee joint is called the thigh. The area between the knee joint and ankle joint is called leg. The region below the ankle joint is known as the foot. Each region plays a vital role in movement, balance, and supporting the body weight. Let's take a quick and simple look at the surface of the human foot by using diagram. First, let's start with the top part of the foot. This is known as the dorsum of the foot. The dorsum refers to the upper surface. This part is visible when you are standing and looking down at your foot. It includes structures like the tendons of extensor, muscles, and superficial veins. Now, let's go to the bottom. This is called the plantar surface of. The plantar surface is the sole of the foot, that the part that touches the ground when you walk or stand. It contains thick skins and important structures like the plantar fascia and muscles that supports walking and balance. So guys, now this is the last topic in our today's section. Standard anatomical position. What is standard anatomical position? Alright guys, this is one of the most important basic you need to understand in anatomy. Whenever we talk about where something is in the body, like what's front, what's behind, what's on the side, we need a standard reference point. That's why we use something called the standard anatomical positions. It's like saying, let's all imagine the body in this one exact position, so we can all describe parts and direction the same way, no confusion. So, what does this position look like? There are 5 key things to remember. First, the person is standing upright, not lying down, no sitting. Second, the head, eyes and toes are all facing straight forward. Third, the arms are hanging, relaxed by the sides. Fourth, the palms are turned forward, not backward. This is called supinative position. Fifth, the legs are together and the feet are pointing forward. Why is this important? Because this is the position we use to describe terms like anterior, front, posterior, back, medial towards center, and lateral towards side. Even if a person is lying, down or moving, we always use these standard positions as the reference when describing any structures in the body. So, that's the standard anatomical position. The very first steps to mastering anatomy. Remember, every expert once started with the basic. Keep going, stay curious and don't give up. Amazing things takes time. Stay tuned for the next session. We are just getting started on this exciting journey through the human body. And hey, if this helped you, don't forget to like, share and subscribe. Let's grow and learn together.